From thinking aspirin is just for headaches, to believing your EpiPen will last forever, to panicking when an infection spreads and you've got nothing, these are the 10 medications you should always have at home after 50. And they're so critical that even your doctor might not tell you which ones actually matter. But first is low-dose aspirin, which isn't what most people think. Because when you're over 50 and having a heart attack, 325 milligrams of aspirin improves survival rates by nearly 25%. That's huge. But what do most people have? Ibuprofen, acetaminophen, maybe some expired baby aspirin. And when chest pain hits at 3 a.m., they're fumbling through garbage while their heart muscle dies. Because ibuprofen doesn't thin blood, it just makes you feel slightly better while you die. Thanks for nothing, medicine cabinet. Over 400,000 Americans die from heart attacks annually. A $5 bottle of the right aspirin could change that. But nobody prepares until it's too late. But first is low-dose aspirin, which most people think is just for headaches. Wrong. Because when you're over 50 and clutching your chest at 3 a.m., that 325 milligrams aspirin tablet is the difference between surviving a heart attack and not. The idea is simple. Aspirin thins your blood, breaks up the clot forming in your coronary artery, and buys you precious time until the ambulance arrives. But what actually happens? People grab ibuprofen instead. Or Tylenol. Or some expired baby aspirin from 2019 that's lost all its potency, none of which does a damn thing for your heart. Heart attacks kill over 400,000 Americans every year, and studies show that taking 325 milligrams of aspirin within the first few minutes of chest pain can improve survival rates by up to 25%. That's massive, but you need the right kind. Not baby aspirin at 81 milligrams, which is for daily prevention. Not ibuprofen, which is an anti-inflammatory that won't touch a blood clot. Actual aspirin, 325 milligrams tablets. The kind that says aspirin on the label and nothing else. Most medicine cabinets don't have it. Instead, people have 17 bottles of random supplements, expired cold medicine from the Obama administration, and maybe some Tums. So when that crushing chest pain hits, and every second counts, they're fumbling through garbage while their heart muscle dies. The average ambulance response time in America is 7 minutes in cities, 14 minutes in rural areas. That's a long time to wait without aspirin working in your system. Cardiac tissue doesn't care about your zip code. But at least aspirin is cheap and easy to find. What's really nuts is not having antihistamines, which most people think are just for seasonal allergies. Not even close. Because diphenhydramine, the generic name for Benadryl, is your first line of defense against severe allergic reactions. You know, the kind that close your throat and kill you in minutes. Sure, if you're severely allergic to bees or peanuts, you probably have an EpiPen. Great, but here's the problem. EpiPens expire fast, usually within 12 to 18 months, and they cost $600 to replace, even with insurance, because pharmaceutical companies are doing this for profit, not kindness. So most people let them expire and hope for the best. Terrible plan. Because while an EpiPen is ideal for severe anaphylaxis, antihistamines can handle a ton of allergic reactions on their own. Hives, swelling, mild breathing difficulty, that weird throat-tightening feeling you get from shellfish you didn't know was in the pasta. Diphenhydramine, at 25 to 50 milligrams, can stop these reactions in their tracks. And it costs about $8 for a bottle of 100 tablets. But most people don't have it. Or they have the non-drowsy kind, which doesn't work as well in emergencies. And when someone's lips start swelling at a family dinner, and the nearest hospital is 20 minutes away, suddenly, that $8 bottle looks pretty smart. Over 200,000 Americans end up in the ER every year for allergic reactions. Many of those visits could have been avoided with antihistamines at home. But instead, people wait. They think, maybe it'll get better. And sometimes it does. But sometimes their airway closes, and they're coding in the back of an ambulance. No thanks. So to recap, aspirin for heart attacks, antihistamines for allergic reactions, 2 medications, maybe $15 total. That could literally save your life. But most people's medicine cabinets look like a pharmacy exploded in 2015, and nobody cleaned it up. Expired NyQuil, mystery pills in unlabeled bottles, and enough ibuprofen to last until 2040. Everything except what actually matters. But if you thought those oversights were dangerous, wait until you hear about this next one, because fever after 50 isn't just uncomfortable, it's a warning sign your body is fighting something serious. And the wrong medication can turn a manageable situation into liver failure. But that's not as dangerous as acetaminophen, which most people know as Tylenol. Seems harmless, right? It's what you take for headaches, fever, general aches. Except here's the problem. After 50, your liver doesn't process medications the same way. And acetaminophen is shockingly easy to overdose on, especially when you're taking multiple medications that already contain it. Because acetaminophen is everywhere. It's in cold medicine, flu medicine, sleep aids, prescription pain relievers, even some allergy medications. So you take 2 Tylenol for your headache, then some NyQuil for your cold, then maybe a prescription painkiller for your back. Congratulations, you just blew past 4,000 milligrams, the maximum daily dose, and you're now in liver damage territory. Over 56,000 Americans end up in the ER every year from acetaminophen overdoses, not from suicide attempts, from accidents, from people who thought they were just managing their symptoms and instead destroyed their livers. And after 50, when your liver is already working harder to process blood pressure meds and statins, acetaminophen becomes even more dangerous. The safe approach? Keep regular strength acetaminophen, 325 milligrams tablets. And know your limits. That's 2 tablets every 6 hours. Maximum of 8 tablets in 24 hours. Set a timer. Write it down. Because I think I took some earlier isn't good enough when your liver is on the line. And if you drink alcohol regularly, even just a couple glasses of wine with dinner, your safe limit drops even further. Alcohol and acetaminophen together are a liver-killing combination. But here's what really gets me. Most people have no idea. Their doctors don't always explain it. The warning labels are buried in tiny print. And when they're miserable with a fever, they just keep taking pills until they feel better, which works great until it doesn't. Speaking of things your doctor might not explain, let's talk about antacids. Most people think these are just for heartburn after eating too much pizza. Wrong again. Because after 50, that burning sensation in your chest might not be indigestion at all. It could be a heart attack, and thousands of people die every year because they took some Tums and went back to bed instead of calling 911. The symptoms overlap: chest discomfort, burning, pressure, sometimes pain that radiates to your jaw or arm, heart attack, or severe acid reflux. Without an EKG, even doctors can't always tell immediately. But here's the thing. If it is reflux, antacids won't kill you. If it is a heart attack and you ignore it, you're done. So yes, you should have antacids. Specifically, both fast-acting options like calcium carbonate, which is Tums, and a proton pump inhibitor like omeprazole, which is Prilosec. The fast-acting stuff works in minutes for acute heartburn. The PPI works over days and weeks for chronic issues like silent reflux, which damages your esophagus without you even feeling it. But here's where it gets complicated. PPIs have their own problems. Studies show that long-term use, we're talking months or years, increases your risk of kidney disease, bone fractures, and nutrient deficiencies. Because when you reduce stomach acid too much, your body can't absorb calcium, magnesium, and vitamin B12 properly. So you're supposed to take them for short periods, maybe 2 weeks at a time, unless your doctor specifically says otherwise. Of course, most people don't do that. They take them daily for years because it's easier than figuring out what's causing the reflux. Which brings us back to the heart attack problem. If you're popping omeprazole every day and you suddenly get severe chest pain, you might dismiss it as just reflux acting up. Even though your medication should be controlling it, that's a red flag. That's when you call 911. The timing matters too. Antacids work best when taken on an empty stomach, 30 minutes before meals. Most people take them after they're already miserable, which still helps but isn't optimal. And calcium carbonate can interfere with other medications, so can PPIs. Your blood pressure medication, your thyroid medication, your osteoporosis medication, all can get blocked or reduced in effectiveness. Nobody tells you this stuff. You're just supposed to figure it out. But at least fever and heartburn give you warning signs. What's truly terrifying is what happens when your heart or brain betrays you without warning, because the next medications aren't for comfort. They're for survival in those first critical minutes, when death is closing in fast. Now we're getting into the medications that separate preparedness from survival, because when your heart stops working properly or your blood pressure spikes into stroke territory, you've got maybe 10 minutes. And in those 10 minutes, the right medication can mean the difference between full recovery and permanent brain damage. Or death. First up is nitroglycerin, which most people have never heard of unless they've already had a heart attack. It's a tiny sublingual tablet that dissolves under your tongue and opens up your blood vessels within minutes, allowing blood to flow back to your heart muscle. When you're having a heart attack or severe angina, your coronary arteries are blocked or severely constricted. Nitroglycerin relaxes those blood vessels, buying you critical time until professional help arrives. The problem? It requires a prescription, and most doctors won't prescribe it unless you've already had heart problems or you're at extremely high risk. So the people who need it most, the ones with borderline cholesterol, family history, high blood pressure, or diabetes, usually don't have it. They're supposed to wait until their first heart attack, then get the prescription for next time. Great system we've got here. But if you're at risk, and honestly if you're over 50, you should assume you are, talk to your doctor about getting a prescription. Be specific. You want the sublingual tablets, 0.4 milligrams, not the patches. The protocol is simple. Chest pain, take 1 tablet under your tongue. Pain doesn't ease after 5 minutes, take another. Still nothing after another 5 minutes? Take a third and call 911 if you haven't already. Studies show that nitroglycerin taken during early stages of a heart attack can reduce heart muscle damage by up to 40%. That's the difference between needing a stent and needing a transplant. Between walking out of the hospital in 3 days and spending weeks in cardiac rehab. Between living independently and moving into assisted care. But here's the catch. Nitroglycerin has a shelf life of only 3 to 6 months after you open the bottle. The tablets lose potency fast, especially if exposed to heat or light, so you need to replace them regularly, which means paying for new prescriptions. Most insurance companies hate this. They'll fight you, claim you're stockpiling, make you jump through hoops, because apparently staying alive isn't reason enough. Now, as critical as nitroglycerin is, there's another medication even more important for most people over 50. Your blood pressure medication, whichever one you're on, whatever it's called, you need a backup supply. Not just the current month's prescription. A 90-day supply minimum, ideally more, because missing even a few doses can spike your pressure into dangerous territory. We're talking stroke levels, heart attack levels, kidney damage levels, and the consequences can hit within 24 to 48 hours, depending on the medication and how severe your hypertension is. But the American healthcare system has decided that making it difficult to stockpile medications is more important than keeping people alive. Insurance companies typically won't authorize refills until you're almost out. Pharmacies can't legally give you extra without authorization. And if there's a supply chain disruption, which happened repeatedly between 2020 and 2023 with common blood pressure medications like lisinopril and losartan, you're just out of luck. Remember 2021, when half the pharmacies in America couldn't get certain generic blood pressure meds for weeks? People were rationing pills, skipping doses, trying to stretch their supply, and stroke rates went up. Not coincidentally. This is insane. Blood pressure medication isn't a controlled substance. It's not addictive. There's no black market for lisinopril. But the system is set up to keep you dependent on monthly refills, monthly copays, monthly trips to the pharmacy. The workaround? Ask your doctor to prescribe a 90-day supply instead of 30. Most insurance will cover it, and it's actually cheaper for them. If your insurance won't budge, use a mail-order pharmacy or GoodRx. The generic versions are dirt cheap. Often $10 to $20 for 90 days without insurance. And if you travel, if you live rurally, if you have any reason to worry about pharmacy access, ask your doctor for an emergency backup prescription. Frame it as disaster preparedness. Most reasonable doctors will work with you. Because your heart and brain don't care about insurance bureaucracy. When your blood pressure spikes to 200/120, and your cerebral arteries start leaking, you don't have time to argue with a pharmacist. Your heart and blood pressure are covered, but your digestive system? That's a whole different nightmare that kills more seniors than most people realize. Let's talk about anti-diarrheal medication, specifically loperamide, which is Imodium. Most people think diarrhea is just an inconvenience. Uncomfortable, sure. Embarrassing, maybe, but not dangerous. Dead wrong. Because after 50, severe diarrhea can dehydrate you so fast, it'll put you in the hospital or kill you. Your body doesn't hold on to water the same way anymore. Your kidneys are less efficient. And when you're losing fluids from both ends, whether from food poisoning, a stomach bug, or side effects from antibiotics or blood pressure medication, dehydration can spiral into a medical emergency within hours. Over 17,000 Americans die every year from complications related to dehydration. Many of them are seniors who thought they could tough it out. Drink some water, wait for it to pass. Except when you're losing fluid faster than you can replace it. Drinking water isn't enough. You need to stop the loss. And that's what loperamide does. It slows down your intestinal tract, giving your body time to reabsorb water and electrolytes. The standard dose is 2 mg after the first loose bowel movement, then 2 mg after each subsequent one, up to 8 mg per day. Simple, cheap. A bottle of 48 tablets costs about $6 at any pharmacy. But most people don't have it until they need it, which means they're already in crisis mode, possibly too weak to drive, definitely too miserable to think straight. And here's the kicker. Dehydration doesn't just make you feel terrible. It triggers a cascade. Your blood pressure drops. Your heart rate spikes. Your electrolytes go haywire, which causes confusion, dizziness, and falls. Falls in people over 50 often mean broken hips, which means surgery, which means a 30% chance of dying within a year. All because of diarrhea that could have been stopped with a $6 medication. But even if you avoid dehydration, there's another silent killer most people completely ignore: sleep deprivation. And before you roll your eyes thinking this is about feeling tired, understand that chronic sleep deprivation after 50 is directly linked to cognitive decline, increased fall risk, heart disease, and early death. The data is brutal. People over 50 who regularly sleep less than 6 hours per night have a 30% higher risk of dementia. Their reaction times slow down. Their balance gets worse. Their risk of falling and sustaining life-threatening injuries more than doubles. Sleep isn't a luxury. It's when your brain clears out toxic proteins, when your body repairs itself, when your immune system does its most important work. But here's the problem. A lot of people over 50 can't sleep. Medications keep them up. Anxiety keeps them up. Pain keeps them up. Frequent urination keeps them up. And they just accept it as part of getting older, like it's inevitable. It's not. Now, I'm not talking about taking Ambien every night. Those come with their own risks: dependency, next-day grogginess, increased falls. What I'm talking about is having a safe option for when you genuinely need it. And for most people, that means melatonin, but not the way most people use it. Melatonin isn't a knockout drug. It's a hormone that regulates your sleep-wake cycle. The key is taking it correctly: 0.5 milligrams to 3 milligrams, taken about 2 hours before bedtime, not right when you're trying to fall asleep. And it works best when combined with actual sleep hygiene: dark room, cool temperature, no screens. Most people take 10 milligrams right before bed and then wonder why it doesn't work. Wrong dose, wrong timing. But melatonin isn't for everyone. If you're on blood thinners, immunosuppressants, or diabetes medication, it can interact badly. And if you have severe insomnia, melatonin alone won't cut it. That's when you need to talk to your doctor about other options, like trazodone or doxepin, which are older medications, safer for long-term use than Ambien. The point is this: sleep matters. Chronic sleep deprivation will kill you just as surely as a heart attack. It just takes longer. And having a safe medication to break the cycle when you're stuck in insomnia is critical, because when you're exhausted, everything else gets worse. You forget to take your other medications. You make bad decisions. You trip over things you'd normally see. Your blood sugar goes haywire. Your blood pressure spikes. And before you know it, you're in the ER for something that could have been prevented if you'd just gotten some sleep. So far, These are all things you could figure out with some research. But these next medications? Your doctor probably never mentioned them. And that's exactly the problem. You've probably never heard of glucose tablets, and honestly, why would you? Unless you're diabetic or know someone who is, they're not on your radar. But here's the thing. Low blood sugar doesn't just affect diabetics. It can happen to anyone over 50 who's taking certain medications, skipping meals, or dealing with specific health conditions. And when your blood sugar crashes, you've got maybe 15 minutes before you're confused, sweating, shaking, and potentially seizing. After that, brain damage or death. Hypoglycemia, the medical term for low blood sugar, kills thousands of people every year. Not just from diabetes complications, from medication interactions, from blood pressure medications, especially beta blockers, that can mask the warning signs, from older adults who skip breakfast, take their medications on an empty stomach, and then wonder why they're dizzy and disoriented an hour later. The symptoms come on fast: confusion, sweating, rapid heartbeat, blurred vision, weakness. And if you're alone, if you can't think clearly enough to realize what's happening, you might pass out before you can do anything. At that point, you're hoping someone finds you before permanent brain damage sets in. The fix is stupidly simple: glucose tablets or glucose gel. These are pure dextrose that your body absorbs within 5 to 10 minutes. Not candy, not orange juice, not a sandwich. Those all take too long to digest and convert to usable blood sugar. You need something that hits your bloodstream immediately. Glucose tablets cost about $5 to $10 for a bottle of 50. They're shelf-stable for years, and they work for anyone experiencing hypoglycemia, whether you're diabetic or not. The standard protocol is to take 15 to 20 grams of glucose, wait 15 minutes, and check if symptoms improve. If not, take another 15 grams. But here's what most people don't realize. Certain blood pressure medications, especially when combined with diabetes medications or just with irregular eating patterns, can drop your blood sugar dangerously low. ACE inhibitors, beta blockers, and some diuretics all have this risk. And doctors don't always explain it clearly, because they're focused on managing your blood pressure, not on every possible side effect. So you're taking your medications like you're supposed to, you skip lunch because you're busy, and suddenly you're sweating and confused, and you have no idea why. If you're driving when this happens, you're a danger to yourself and everyone around you. If you're home alone, you might not be able to call for help before you lose consciousness. Over 100,000 Americans end up in the emergency room every year for severe hypoglycemia. Many of those are people over 50 who had no idea they were at risk. And an ER visit for hypoglycemia will run you anywhere from $1,500 to $5,000, depending on how long you're there. Compare that to a $7 bottle of glucose tablets. The cost-benefit analysis isn't even close. But most people don't think about this until it happens to them. And by then, it's too late to prepare. Now, glucose tablets handle one type of emergency. But what about infections? What about when a simple cut, a UTI, or a dental abscess turns into something life-threatening? Because after 50, your immune system doesn't respond to infections the way it used to. What might have been a minor inconvenience at 30 can spiral into sepsis at 60. And sepsis kills fast. Here's the reality. Infections that go untreated for even 24 to 48 hours can turn deadly in older adults. A urinary tract infection spreads to your kidneys and then your bloodstream. A dental abscess causes brain swelling or heart complications. A small wound that gets infected leads to necrotizing fasciitis, which is flesh-eating bacteria. The common thread? All of these start small. All of them are treatable with antibiotics if caught early, and all of them can kill you if you wait too long. But getting antibiotics in America requires a prescription, and getting a prescription requires seeing a doctor. And seeing a doctor requires an appointment, which might not be available for days or weeks, depending on where you live and what insurance you have. So people wait. They hope it gets better. They try home remedies. And sometimes, by the time they finally get to a doctor, the infection has already spread. This is why you should have a broad-spectrum antibiotic at home. I'm not saying stockpile narcotics. I'm talking about amoxicillin or azithromycin, basic antibiotics that treat common infections. The most important medication on this list, a broad-spectrum antibiotic, specifically amoxicillin or azithromycin. And if you think that sounds extreme, let me explain why it's actually the most critical thing you can have. Because infections don't wait for doctor's appointments, and after 50, your immune system doesn't fight them off the way it used to. A simple urinary tract infection progresses to a kidney infection in 24 hours, then to sepsis in another 12. A dental abscess spreads to your bloodstream and causes endocarditis, which is inflammation of your heart valves. A minor cut that gets infected turns into cellulitis, then necrotizing fasciitis, literally flesh-eating bacteria. The progression from minor problem to life-threatening emergency can happen in less than 48 hours. And sepsis, which is your body's overwhelming response to infection, kills over 270,000 Americans every year. It's one of the leading causes of death in hospitals, and the mortality rate climbs dramatically with every hour of delayed treatment. Early antibiotic treatment is the difference between full recovery and organ failure. Studies show that for every hour you delay antibiotics after sepsis symptoms start, your chance of dying increases by 7%. So, if you wait 6 hours to get to a doctor, get diagnosed, get a prescription, and get to a pharmacy, you've increased your mortality risk by over 40%. That's insane. Now, I know what you're thinking, but antibiotics require a prescription. And isn't this how we get antibiotic resistance? Both valid concerns. But here's the reality. The American healthcare system is set up in a way that actively prevents people from getting timely treatment for infections. Especially if you're rural, uninsured, underinsured, or dealing with any access barrier. Let's talk about what happened during COVID. Telehealth was overwhelmed. Urgent care centers had 6-hour waits. Some rural areas had no available doctors for days or weeks. People with serious infections, UTIs, respiratory infections, skin infections, just suffered. Some died. Not from COVID. From treatable bacterial infections that couldn't be treated because the system collapsed. And it's not just pandemic conditions. Pharmacy deserts are real. There are entire counties in America where the nearest pharmacy is 30 miles away. Insurance prior authorization can delay antibiotics for days, while you prove to some bureaucrat that yes, you really do need treatment. And if you don't have insurance, good luck affording a doctor's visit, let alone the prescription. The workaround exists, but nobody talks about it. Telemedicine services can prescribe antibiotics for certain conditions, usually UTIs, sinus infections, and respiratory infections. You describe your symptoms, a doctor reviews your case remotely, and if appropriate, they send a prescription to your pharmacy. It's not perfect, but it's better than suffering for a week waiting for an appointment. Some people, and I'm not advocating this, but I'm telling you it's a reality, use fish antibiotics. Because amoxicillin is amoxicillin, whether it's prescribed for humans or sold for fish tanks. Same active ingredient, same dosage. Is it FDA approved for human use? No. Is it chemically identical? Yes. Do desperate people use it? Absolutely. The better approach is to have an honest conversation with your doctor. Tell them you want a backup prescription for emergency situations. Frame it as disaster preparedness. Most reasonable doctors will work with you, especially if you have a history of recurring UTIs, respiratory infections, or other issues. For amoxicillin, the typical dose is 500 milligrams 3 times daily for 7 to 10 days. For azithromycin, it's usually 500 milligrams on day 1, then 250 milligrams for 4 more days. These treat most common bacterial infections: respiratory, urinary, skin, dental. They won't treat viral infections like the flu, and they won't treat antibiotic-resistant bacteria. But for the vast majority of bacterial infections people over 50 encounter, they work. Storage is simple. Keep them cool, dry, away from light. Most antibiotics stay effective for years, past their expiration date, if stored properly, though potency gradually decreases. And yes, you need to know when not to use them. If you have severe symptoms, like high fever over 103 degrees Fahrenheit, confusion, difficulty breathing, chest pain, or signs of sepsis like rapid heart rate and low blood pressure, you need emergency medical care immediately. Home antibiotics are not a substitute for the ER. But for situations where you have a clear bacterial infection, you know what it is, and you can't get to a doctor quickly, having antibiotics at home can literally save your life. The alternative is waiting, hoping it gets better, and gambling that you'll get treatment before the infection spreads. And remember, we're talking about being prepared for system failures, not replacing medical care. The goal isn't to never see a doctor, it's to not die waiting for an appointment. So now you know the 10 medications. But here's the problem most people still make. Even after learning all of this, they go out, they buy everything, they shove it in a drawer, and then they forget about it, until the emergency happens and half of it's expired. Knowing the list isn't enough. Here's what actually kills people: poor storage, expired medications, and complete disorganization. Because at 3 a.m., when you're having a medical emergency, you don't have time to dig through expired bottles trying to figure out which medication is which. Let's start with storage. Most people throw everything into a bathroom medicine cabinet. Terrible idea. Bathrooms are humid from showers, temperature fluctuates constantly, and humidity destroys medication potency faster than almost anything else. Heat and moisture are the enemies of pharmaceutical stability. The right place? A cool, dry, dark location. A bedroom closet shelf works. A kitchen cabinet away from the stove works. Some medications, like certain antibiotics and insulin, need refrigeration. Check the labels, and keep everything in its original packaging so you can see dosing instructions and expiration dates. Speaking of expiration dates, they matter, but not the way most people think. Most medications don't suddenly become toxic the day they expire. They lose potency gradually. A 5-year-old bottle of ibuprofen is probably still 80% to 90% effective. But there are critical exceptions. Aspirin breaks down into acetic acid and smells like vinegar when it expires. If your aspirin smells like vinegar, throw it out. Nitroglycerin loses potency within 3 to 6 months of opening the bottle. Antibiotics degrade and become less effective, which is dangerous, because taking ineffective antibiotics is how you breed resistant bacteria. And EpiPens should be replaced immediately when they expire, because epinephrine degrades quickly. For everything else, use common sense. If it looks discolored, smells weird, or the texture has changed, toss it. Otherwise, understand that expiration dates are often conservative estimates. The military did a study and found that most medications retain 90% potency for years past their expiration date when stored properly. But here's the real problem: organization. When you're in crisis, you need to know exactly where everything is. Label everything clearly. Use a plastic storage bin or tackle box with compartments. Group medications by purpose. Cardiovascular in one section, pain and fever in another, digestive in another, emergency supplies, like glucose tablets, and antibiotics in their own section. And make a list. Write down what you have, the dosages, and when you need to replace them. Set phone reminders for medications that expire quickly. This isn't complicated, but it's the difference between calm, effective response and panicked fumbling while your condition worsens. Now, let's talk about access barriers, because having the knowledge doesn't help if you can't actually get these medications. Some of them, like aspirin and antihistamines, are over the counter. Easy. But prescription medications require navigating the medical system, and that system is deliberately designed to be difficult. Here's how to talk to your doctor. Be direct. Don't hint. Say, I want to have emergency medications at home in case of disaster or access issues. I'd like prescriptions for nitroglycerin, a 90-day supply of my blood pressure medication, and a backup antibiotic like amoxicillin. Most reasonable doctors will work with you, especially if you frame it as preparedness. If your doctor refuses, find a different doctor. Seriously. If they're not willing to help you prepare for medical emergencies, they're not prioritizing your survival. For costs, use GoodRx or similar discount programs. Generic medications are shockingly cheap without insurance. A 90-day supply of lisinopril is about $10 to $15 at Costco or Walmart with a GoodRx coupon. Amoxicillin is even cheaper. You don't need insurance to afford this if you're smart about where you buy it. Telemedicine is another option. Services like Push Health, PlushCare, or K-Health can prescribe many of these medications after a virtual consultation. It's not free, usually $50 to $75 for the consultation. But if you're uninsured or your regular doctor won't help, it's a viable alternative. And yes, some people use international online pharmacies. I'm not going to tell you to do this, but I'm also not going to pretend it doesn't happen. Medications from Canadian or Indian pharmacies are often chemically identical to American versions and cost a fraction of the price. The legality is murky, the FDA frowns on it, but desperate people make desperate choices. The point is, don't let the system's barriers stop you from preparing. Work within it when you can. Work around it when you must. But even with perfect preparation, you need to know when home treatment isn't enough. If you have chest pain that doesn't improve with aspirin and nitroglycerin, call 911. If your blood sugar won't stabilize with glucose tablets, call 911. If you have signs of severe infection, like confusion, rapid breathing, very high fever, or low blood pressure, go to the ER immediately. Home medications are for buying time and handling situations where professional care is delayed. They're not replacements for emergency medicine. Know the difference. Look, I get it. This seems like a lot, but consider what happens when you don't do this. Let me tell you about Margaret, 67 years old. Living in rural Montana, she had a urinary tract infection that started on a Friday. Mild discomfort, nothing unusual. By Saturday, she had a fever and back pain. Her nearest urgent care was 45 miles away and closed for the weekend. She figured she'd wait until Monday. By Sunday morning, she was confused and disoriented. Her daughter found her on the bathroom floor, heart rate at 140, blood pressure at 80/50, sepsis. The ambulance took 28 minutes to arrive. She spent 3 weeks in intensive care, lost kidney function, and now requires dialysis 3 times a week for the rest of her life. A 7-day course of amoxicillin would have cost $12. Instead, her medical bills topped $180,000. And more importantly, her independence is gone. All because she didn't have basic antibiotics and couldn't access medical care when she needed it. Or take Robert, 72, who had chest pain at 2 a.m. He took ibuprofen instead of aspirin because that's what he had. By the time the ambulance arrived 15 minutes later, he'd suffered significant heart damage. He survived, but his ejection fraction, which measures how well your heart pumps, dropped from normal to 35%. He can't walk upstairs anymore without getting winded. He'll be on disability for the rest of his life. A bottle of aspirin costs $4. These aren't hypothetical scenarios. These are composite stories based on real cases that happen every single day in America. People die or suffer permanent disability from preventable emergencies because they weren't prepared with basic medications. So let's recap the 10 medications you need. Number 1. Low-dose aspirin. 325 milligrams tablets for heart attacks. Number 2. Antihistamines, like diphenhydramine, for severe allergic reactions. Number 3. Acetaminophen for fever management, but watch your dosing carefully. Number 4. Antacids, both fast-acting and PPIs for reflux and potential heart attack symptoms. Number 5. Nitroglycerin if you're at cardiac risk. Number 6. A 90-day supply of your blood pressure medication. Number 7. Anti-diarrheal medication, like loperamide, to prevent dehydration. Number 8. Sleep aids, whether melatonin or prescription options for chronic insomnia. Number 9. Glucose tablets for hypoglycemia. And number 10. A broad-spectrum antibiotic like amoxicillin or azithromycin. Total cost if you're starting from scratch? Somewhere between $150 and $300, depending on what requires prescriptions and what your insurance covers. Compare that to a single ER visit, which averages $2,600 without insurance, or the cost of long-term disability from a preventable medical emergency. This isn't about being paranoid, it's about being realistic. The American healthcare system is designed to profit from your emergencies, not prevent them. Insurance companies make money by denying claims and delaying care. Pharmaceutical companies make money by keeping you dependent on monthly refills. Hospitals make money when you show up in crisis, rather than managing problems early. You can't change the system, but you can prepare for it to fail you, because it will. Whether it's a natural disaster, a pandemic, a pharmacy shortage, an insurance denial, or just living too far from adequate medical care, at some point, you will be on your own. And when that moment comes, these 10 medications could be the difference between a manageable situation and a tragedy. Hope for the best. Prepare for the worst. Stock your medicine cabinet like your life depends on it. Because someday, it might. But there's more to staying healthy after 50 than just having the right medications. You also need to know which medical tests actually matter and which ones are just revenue generators for the healthcare industry. Because doctors won't always tell you the truth about what you actually need. So click this video right here, cause this one's over. And trust me, what you're about to learn could save you thousands of dollars and years of your life.